Right, welcome everyone. Unfortunately, I can't see those that are joining us through the webinar. Not sure if I'm even able to get any feedback from.
Yeah, they can chat and I can let you know if they're.
Okay, it looks like you guys can chat, they will go ahead and let me know what are some of your questions. Or if I'm moving too fast, please feel free to say slow down a bit. I tend to do that. By the way, my name is Dr. Thomas Aubrey. I'm actually a professor at Glendale Community College, and I am the director for the Behavioral Health Sciences program. And one of my passions really is, and my mission is to help future mental health professionals, and not just mental health professionals, but anyone that's working in a stress-related field, to develop resiliency. And that's really, in essence, what we'll be talking about is what is resiliency. And I'll just go to the next slide so you can kind of get an overview of what we'll be considering. We'll talk about what is resiliency and briefly take a look at what does resiliency look like. And I say this is very brief because when I give this training, you're looking at anywhere from 8 hours to a full. We actually have a class on resiliency at Glendale, which would be about almost 25 hours of in-class training of resiliency. And you're getting just an overview within 1 hour of some of the skills that they teach. My hope is by the end of this webinar, you'll have at least one skill, one of the many that we teach, that you can start practicing your work. So we'll take a look at the cause of stress. And it may be a difficult pill to swallow because it's a different perspective and outlook of what really causes stress. Then we're going to go ahead and turn our attention to the autonomic nervous system and what happens in the body when we get stressed out by these stressors in our environment. And of course, as I mentioned, my hope is to give you at least one tool. There are many. There are actually 6 skills, domains that we train folks to build resiliency. But we'll talk about the first domain, which is self-regulation. I'll give you one tool that you can take home today. Before I get started, I'd like to give a fair warning. If you see me wiggling in my chair, it's only because I injured my back this morning lifting weights. Besides giving this presentation, I was at the point, can I come here and give the presentation? But I really wanted to be here to give the presentation just because of my passion about the subject. So I might just kind of be wiggling around. There's nothing wrong. I don't have a tic. It's just basically I'm trying to get comfortable and trying to find a space where my back's not killing me as much. So let's get into what resiliency looks like. And each of you, when I bring up the word resiliency, you might have an image of what resiliency looks like for you. These are some of the images that you see up here that represent resiliency for me. And for those of you at home, I'm hoping you don't have weeds growing out of your keyboards, but it really does depict what resiliency is, despite the fact that there's these obstacles, at least for the plant that's growing out of the cement cracks. Despite these obstacles and these places where they shouldn't be growing and flourishing, you see this resiliency of these plants just growing and flourishing. And then sometimes in places where they shouldn't be flourishing, such as your keyboard. But that really does represent to me resiliency. And when I think about the honey badger really to me brings an image of at least a creature that is resilient. And if you've ever done some research on the honey badger, they're just amazing creatures. For one, they can live in just the most uninhabitable places on earth, where nothing is growing, and yet they still survive. They just have that strength and that resiliency to survive anywhere. But if you ever get an opportunity to YouTube or go to National Geographic and watch a video of the honey badger, it's just amazing how the honey badger can pick the food in the food chain just pick these foods or nourish themselves with foods that most of us would never ever think of attempting to eat, such as a venomous snake, such as a cobra. But it's interesting, and just last night I was watching this before I came here, and I noticed how the honey badger was preying on this cobra, and the cobra actually bit or struck the honey badger on the chin. And then in a matter of minutes, you saw the honey badger just pass out. And it was out for about an hour or so. And it then regained consciousness, shook itself, and then started eating the snake. And just walks away as if nothing happened. And to me, that really shows the strength and resiliency of this creature. And it really talks about what resiliency is. When we look at the Latin word for resiliency, it really means to spring back or to rebound. And in human biology, really it's the ability of our physiology or our biology to sustain itself during competence during times of stress. Of course, it is during the times that our bodies are stressed out by viruses or illnesses, but even stress, psychological and emotional stress, it is really that ability for us to spring back, rebound, and come back to where we previously were, and that is really resiliency. And if you take a look at stories, just about every religion has stories of individuals that were able to face adversity, challenges in life, and they were able to become resilient, just to rebound. And many of them even become stronger than they were previously. And that really what we're talking about, resiliency. And how do we build those resiliency for us to become resilient in the most stressful environments? And so for those of us that work in the mental health environment or the healthcare environment, we can understand that this is a toxic environment. The work that we do, helping others who are suffering, helping others who are in pain, it isn't possible if we display the human characteristic of empathy to help somebody and not hurt. And if we continue helping somebody and experiencing that hurt, which is absolutely natural, then we can experience bouts of burnout, compassion fatigue, work-related stress, traumatic stress. And those can have an impact not just on our personal life, but also our professional life. And as you can see up here, here's an image. This is actually a research done with physicians. But if you take a look at the research for foster care, for those in mental health, whether you're a case manager, whether you're a family support partner, whether you're a therapist, the research is just about the same. For those of us working in the field, for those of us dealing with the work-related stress, we encounter higher levels compared to others that are not working in such a stressful field of difficult relationships, broken relationships. There's an increased risk for substance abuse and alcohol abuse. There's an increased risk for depression. And when you take a look at the literature, for those that are nurses, for those that are the first care responders, for those in mental health, have increased risk of suicide compared to many of the other professions that don't have to deal with the stressors that we deal with on a daily basis. It also takes a toll on our profession. If you take a look at the chart at the top, it talks about the decreased of quality of care to those that we're serving because of the compassion fatigue that we encounter. We just don't have the energy, the motivation, or the patience to deal with our clients anymore. And so because of such, we have a decrease in quality of care. And of course, that's going to decrease the patient's satisfaction. They're going to report less satisfaction if we don't have the empathy, the compassion, the patience to work with our clients. And of course, a decrease in productivity is also very commonly seen for those individuals that are experiencing bouts of burnout. And that's something that's challenging, because if you're a case manager, you have a certain production that you have to meet per month. Your employer is asking you to produce a certain amount of hours, which in itself may seem stressful, and it is stressful. Or meeting with a certain amount of clients, depending on what agency you're working at. And if you're depressed, in itself, if you're not depressed, if you're not experiencing burnout, if you're not experiencing stress, it's already challenging to meet that quota. But when you're burned out, it becomes nearly impossible for us to meet that quota. So it's important that we start learning how to build resiliency, and that's why we should care about resiliency. Is because if we don't care about resiliency, then we become vulnerable to the stress that can lead to compassion fatigue, stress that can lead to burnout, the stress that can lead to secondary traumatic stress, which then comes with all these negative effects that we show. And it becomes difficult for us and challenging for us to meet the quota, for us to be productive in our work, for us to really care and see good outcomes in our clients or patients, and to become successful in our personal lives. Turnover is something, for those of you that worked in mental health, I've been in the field of mental health for over 15 years. One of my specialties is working with children with trauma. And the saddest thing that I encounter in working with children with trauma is that every time I'm assigned to a new child, they become reluctant to open up to me. And many times they will eventually open up and say, and it's a question, it's not even a statement, how long are you going to stay with me? And really it speaks to the turnover that we find in mental health. Because of burnout, because of compassion fatigue, because of the stress, work-related stress, we have high turnover in this field. And that starts to impact our clients as well. So what I'd like to do is turn our attention, because as you probably heard, the underlying theme was stress. We kept on saying compassion fatigue. The underlying component was stress leading to that. There's other components, and I don't get into, at least this 1 hour workshop, what are the ingredients that really cause compassion fatigue or burnout. Stress is one component of it. And I don't get into, at least this 1 hour lecture, into great depth about compassion fatigue, about burnout, about secondary traumatic stress or primary traumatic stress. As I mentioned, as a professor at the community college, this training I provide to students and to professionals, and it's generally anywhere from 18 to 20 hours of class time. And it's there that I do provide the details of what are the causes of burnout, what are the causes of compassion fatigue, what are the causes of secondary traumatic stress, what are the causes of primary traumatic stress, and what are the effects of such. In this workshop, I just focus on stress, because either way, the other negative effects that we discussed, there's an underlying element of stress. And so I'd like each and every one of you to take a second and just ask yourself, is my life stressful? Is my job stressful? If you're attending school, is school stressful? Are the relationships in your life beyond just romantic relationships, any type of familial relationships, friendships, relationships with your boss. I usually get that that's probably the most stressful in professional's life, is my relationship with my boss, with my supervisor. Are your relationships stressful? And if they are, here's what I'd like you to do. For those of you at home, hopefully you have a pencil and paper at hand, notebook, and I'd like you to pull that out. We're going to do a quick activity. And what I'm going to ask you to do is to write a list of the things that are causing stress in your life. What are the causes of stress in your life? So put a heading, the causes, and make a list of everything that's causing stress in your life. Give you about a minute to do that. All right. I'm sure if I allowed more than a minute, you can come up with probably a dissertation of all the stressors that are in your life. But moving on, let's talk about the effects of these stressors that you listed. So, taking a look at the list of stressors that you listed, I'd like you to write down the negative effects of those stressors. What are the negative effects that those stressors have produced in your life? So I'll give you, and that can vary. It could be, some of you may say that I'm experiencing difficulty sleeping. I'm having difficult time concentrating. Whatever that may be, I want you to go ahead and list under effects, what are the effects of the stressors that you just listed in your life. I'll give you about a minute to do that. All right, that was about a minute. So now that you have a list of the causes of the stressors in your life, and then the effects that you're seeing due to the quote-unquote causes of the stress in your life, what I'd like to move in our next slide is something, and I'd like you to really hear what I'm about to say. It is going to be hard to swallow, because for our entire life we were told that these are the causes of our stress. And many of you probably have a similar list: multiple demands, time constraints, workload for if you're at school, too much homework. I get that a lot from my students. Financial problems, even difficulties in relationship, disgruntled family members, incompetence of others, and the list can continue. You may have things that I didn't list up here, but these are the common things that I hear from students, from professionals when I do workshops. And on the side, for those of you at home, it'll be on your right-hand side. And even for those of you here, you can see it on your right-hand side. Many of you, or many attendees, have listed the following effects. Because you have these stressors in your life, you say that you have irritability, anger, sleeping problems, fatigue, just too exhausted, I'm tired all the time, relational difficulties, compulsive behaviors, somatic issues, maybe headaches, gastrointestinal issues, bad attitude, or even chemical dependency. Now, you may have listed more than I have up here, and that's okay, but I'd like you to hear what I have to say next and really think about this. These are not the causes of your stress. Take a look at your list of causes. Those are not the causes of your stress. Now, it's hard to swallow because we were told all our lives, or we believed all our lives, that these have been the causes of the stress. The reason why I'm stressed out is because my boss keeps on telling me I have to meet a certain quota. And yet I'm up here telling you that those are not the causes of your stress. And in fact, as long as you continue believing that those are the causes of your stress, you're going to continue experiencing the effects that you listed, or even some of the effects that I've listed up here. Now I've set myself up because at this point, if those are not the causes of my stress, and you're telling me if I continue experiencing those, or continue believing that those are the causes of my stress, I'm going to continue experiencing all these negative effects of fatigue, sleeping problems, irritability, anger. So then what are the true causes of my stress? And that's something I generally go through almost an entire day kind of giving some research and giving some experiential exercises for you guys to really understand what are the true causes of your stress. So I'm going to give you the definition, and I'll go over one experiential exercise that can really allow us to grasp what is the true cause of our stress. But the definition really of stress is perceived threat. The true cause of our stress is our perception. And what we are perceiving is threat in our environment, or even threat within, internal or external. And that's the single cause of all stress in human beings. Some of you might say that makes sense, right? My perception, not what's external, not what's outside. It's not my boss, it's not the quota that I have to meet, it's not my job that's causing the stress, it's how I'm perceiving that. It's quite interesting. He's saying how I'm perceiving this as a threat is really what's distressing my body. And because of that, what I'm saying is that your body becomes activated. The threat response system becomes activated. And if it continues on an ongoing basis, if that threat response system continues becoming activated on red line, then it causes the discomfort, it causes the distress, and everything that we've been experiencing, all those effects that we've been discussed or wrote down earlier. Now, that leaves me with, how do you prove that my perception is really the cause of my stress? And let's take an experiential exercise. We're looking at the question up here. I'd like you to be honest with yourself and dive deep and ask yourself, are you 100% safe right now? Think about that. Are you 100% safe right now? In my classroom or in workshops, when I ask this question, I only get about 1% of the participants or students who say, yes, I'm 100% safe right now. Most of the time I get an entire workshop that tell me, no, I'm not 100% safe right now. Or students will tell me, no, I'm not 100% safe right now, which is an interesting response because it tells me a lot about what's happening inside your physiology, what's happening in your brain, that you're perceiving threat in the environment when there actually isn't any threat. Let me go ahead and move to another experiential exercise so I can solidify what I'm trying to say. So what I'd like you to do is for the next 10 seconds, for those of you at home, wherever you're at, if you're in your office, if you're in your living room, in your kitchen, I'd like you to take 10 seconds and just experience your environment without judgment. Now, the way we can do that to experience any objects that we're observing, anything within your room without judgment, is to cut ourselves off from past learning. Anything that we've learned in the past. So if we are observing a lamp, it's just an object that's bright. There isn't any past learning with the lamp. You're just experiencing it. That's it. And I want you to take about 10 seconds and look around your room and see if there's anything that's dangerous. Can you identify anything in your room that's dangerous? Now, when I ask this same question to my students, I get some interesting responses. Of course, I always get the student that says, that projector's dangerous. Okay, how so? It can fall on me. All right. Is that projector falling on you right now? No. Okay. So the projector is not dangerous right now. Of course, they'll say, but it could fall on me. Yeah, it could. But right now in this moment, is that projector falling on you? Because that's all that's real right now in this moment. The past is gone. The future's not here. The only thing that's real, for those of you that have done mindfulness training, the only thing that's real is right now in this moment. And so is the projector falling? No. So the projector is safe right now. And I always have another student who will point to the American flag and say, that's dangerous. That's interesting. How so? Well, someone can take down the American flag and use it as a spear and jab me with it. And I'm always wondering, what on earth are these students watching? But of course, okay. I don't tell them that. Of course, I'm thinking that. But is someone taking that flag down right now and charging at you with that flag? No. So the safest, we can say at this moment in this time right now, that flag is absolutely not dangerous, of no danger. They usually will say, yeah. And my guess is anything that you've come up with, anything you pointed to, anything that you can think about in your room, in a similar way, right now, in this moment, there is no danger. That object is not dangerous. If you've removed yourself from past learned history, you have no learned history. It wasn't a YouTube where you saw someone take down a flag and charge at you and use it as a spear. If you just see it as it is right now and use your 5 senses in this moment, unless there's fire in your room, at which point then there is actual danger and you should react as such. But if there isn't any danger, our body should be 100% safe right now. And the question that we asked earlier, are you 100% safe right now? Should have been yes. In this moment, right now, I'm 100% safe. Of course, I always have a student and say, well, you did prompt us with some destructive and dangerous pictures. And my response is, they're just pictures. That's all they are. Without learned history, those pictures are 100% safe. Those images are not harmful. Now, if we were in front of those images, that would be a different case. But right now, in this moment, we're not. So, why is it that in moments that we should feel 100% safe, we're not feeling like that? Why is it that in moments when there's absolutely no danger in our environment, we're not feeling 100% and our body's becoming activated? Now, I generally go into a long discussion of what happens with the amygdala and what happens with the medial frontal orbital cortex, preorbital frontal cortex, and how they communicate in the singular cortex and how they communicate with one another. But I'm going to go ahead and bypass that discussion. But there are some hypoactive activity occurring in the brain where it should be a little bit more activated, particularly in the executive functions of the brain, where it should be communicating with the amygdala and saying there is absolutely no danger. It's doing a reality testing. Right now, there's nothing dangerous. There's no fire. Nobody's charging at me with that flag, so you should feel 100% safe, and it should deactivate the amygdala. But that's not occurring for many reasons. I don't go into those reasons in an hour lecture, but for many reasons that's not occurring. And then we have the hyperactivity of the amygdala, which starts to, and what we will discuss, eventually activating the autonomic nervous system. And most of you know this, the autonomic nervous system, particularly the sympathetic nervous system, as the fight or flight response. So let's move forth. We know something's happening in the brain that's not allowing us to do some reality testing in the moment to perceive that we truly aren't in danger. And so it's starting to activate through the amygdala, through the release of various hormones. It starts to activate the sympathetic nervous system. And so what happens that when we start perceiving threat, and I'm hoping you're starting to see this puzzle come together, when we're starting to perceive threat, our body is stressed out. Remember, the cause of threat is when we start perceiving threat in our environment. So when we start to perceive threat, and these security system, which is actually, by the way, built to protect you, but at times it gets activated in times that are not productive. We'll get to a couple of examples in a bit. But they become activated, and the sympathetic nervous system becomes activated to help us fight the situation or flee from the situation. For students who fear math is a good example. They walk into a math class and their system becomes activated when there actually isn't any threat. Either they want to fight math. Well, I'm going to become a counselor. I'm never going to need to use math. Why do I have to take this class? They're fighting it. Or they flee for it, or they talk to their advisor. I want to go ahead and take math class at the very end and try to avoid taking math. And so they're fleeing from taking math. Same thing in our work experience. We see our boss, and some of you probably notice, you see your boss and your muscles get tensed. We try to avoid our boss, or we try to fight with our boss and argue with our boss. And it really is our sympathetic nervous system that's becoming activated because we're perceiving threat. And one of the cues that you see up here is tense muscles. One of the cues that your sympathetic nervous system is becoming activated because we're perceiving threat in our environment is that our muscles get tensed. That brings me to an interesting experience where I had a workshop, and this was with law enforcers, and very large officer, he's probably about 6'4" or 6'5", stood up and he's like, you know where my muscles get tensed? Is when my wife says, did you take your vitamins? And I turned to him, I was like, just out of curiosity, I'm just wondering, how tall is your wife? She's probably about 5'1", 5'2". And so it's quite interesting, but that officer was perceiving threat from, which I would imagine, a very lovely and caring wife who was just concerned about her husband. And yet he was perceiving threat out of the question, did you take your vitamins? And his system was becoming activated. Now, I mentioned I generally don't go into where does this all originate? Why is it that I start perceiving threat in my environment when there isn't really any threat? The fact that my 5'1" wife who's telling me, take your vitamins, who's really just worried about my health, and yet my body's perceiving as a threat and I'm becoming activated as such. And of course, some of you can deduce that it's probably coming from past learned history. More than likely, if I were to have sat down with that officer and talked about how was your relationship with your mother or other caregivers in your life, oh, very controlling. Always told me what I should do, what I shouldn't do. And those came out later down the road when he was married in his relationship with his wife, when she stated a word, asked a question, did you take your vitamins, which triggered all those past learning of times that people were trying to impinge on his independence, attempting to make him feel like a baby or less of a man or less, whatever the case may be. And that was threatening to his psyche. And so his body reacted normally and naturally. His body reacted as such, which is a normal response when your body is in threat. But in this case, it was perceived threat that wasn't real. And so he said, my muscles get tensed up every time she asks that. So he was in a state of sympathetic activation. And so that was what happens to us at work or at school or any of the stressors that you guys listed earlier. Our sympathetic system becomes activated. Now, the other part of the autonomic system is the parasympathetic nervous system. And that system becomes activated when we don't have any perceived threat in our environment, when there isn't any danger in our environment. It's in this state when there isn't any danger, there's no perceived threat, and my body can then relax. And so the parasympathetic system allows us to enter in a state of relaxation. But we can only do that when we're not in a state of perceived threat. We're not perceiving threat in our environment. So here's a list of things. I won't go over in detail of everything that occurs when the sympathetic nervous system becomes activated. When you see your boss, when your boss tells you you're under your production for this month, and then you get tensed. Here are the physiological responses that are occurring in your body. Increased heart rate, but more importantly, you can take a look at all the list. It's that observation of my muscles start to tense up. When my boss says, you're under your production for this month, my muscles start to tense up, which is a good indication that I'm starting to perceive threat. Of course, where there isn't any. Now, of course, I always have someone who will argue, well, yeah, it is actual real threat. If my boss tells me that that I'm under production, I can get written up and possibly lose my job, and that is a real threat. And usually I'll bring up, I usually do an experiential exercise, and I actually do this with my students as well. I can't do that here because I don't have too many attendees here and can't do that with folks that are home, but you can work with me. I'll ask you the question. I won't know what the response is, but I'm guessing you'll have similar responses that I get from my students and participants in my workshop. So here's what I do with my students. About midway after midterm, my midterm exams are fairly challenging. But after midterm, I'll ask students, we'll actually go through one of the skills to build resiliency that we won't discuss today, but I'll mention later down the road. What are the 6 resiliency skills? This is perceptual maturation, changing your perception, and cognitive reconstructing. And I'll ask my students, I want you to take a second and just really think about this question. If I give you an F in this class, now that's not a very nice question, I know that. It can be a little traumatizing. But bear with me. If you get an F in this class, you go on to your student center and you see Dr. Aubrey, whatever class you're taking, BHS, Behavioral Health Sciences, 156, and it's an F. On a scale of 1 to 10, How devastating is that? On the grand scheme, how devastating is that? And I go across and I ask and think about that and the same thing. How devastating is it that your boss comes in and tells you you're under production? Or that your boss writes you up? On a scale 1 to 10, how bad is that? 10 being the worst. And I usually go around, and as you can imagine, my students will say 10, 10, 9, 10, 10, 9, 9, 10, 10, 10. Okay. I always get that one student that says 2. All right. I turn around and then I ask them, how devastating, God forbid, on a scale of 1 to 10, how devastating is this if a loved one passes away? And of course, when we're going around class, you get 10, 10, 10, 10, 10, 10. That one that said 2 also says 1 or 2, which is quite interesting. It's another workshop that we can discuss and what's going on with that student. But across the board, 10, 10, 10, 9, 9, 10, 9, 10, 10, 10, 10. Mostly 10s. And I turn to my students and I say, here's what I'm hearing you say. My class is just as important as your loved ones. Can you bring a loved one back? Can you retake my class? And so it really gives that distortion. It really allows students, and that's a Socratic way of debating with them. It's the CBT for those of you who do. It's a way of getting them to a realization that I'm distorting reality. I'm perceiving danger and threat when there really isn't any in my life. And most of the time, students get that. No, it shouldn't be. The fact that I get an F in this class shouldn't be at a 10. Now, of course, I always get that one student, but you tricked me. You didn't ask me that was you didn't tell me that you were going to ask that second question. It's like, yeah, it could be, but does life ever forewarn you of things that are occurring? No. And so it really is our ability to develop, and that's actually one of the skills, not the skill we'll be talking about today, but it's actually one of the skills that I help students and I help professionals develop, is that ability to develop that perceptual maturation to perceive, am I really in danger? Is this truly dangerous and a threat to my life? And if it isn't, should my sympathetic nervous system be activated? Or should my parasympathetic nervous system be activated? Here's what a healthy nervous system actually looks like. We have, as you can see, this homeostasis of balanced flow. And because I'm not saying that we should never have an activated parasympathetic nervous system. If we have a baseline of a flat line of a parasympathetic nervous system, we're just constantly just parasympathetic domination, parasympathetic activated, we wouldn't have passion in life. It is our sympathetic nervous system that gives us the passion, gives us the energy to do things in life. But if we're on the other end of the spectrum and we're constantly on red line, then we increase our chances of experiencing all the symptoms, all the causes that you had listed earlier. We increase our probability of cardiovascular diseases. We increase our probability of stress-related illnesses. So what we want is a balance of activation of the parasympathetic nervous system, and then we have this burst of energy of the sympathetic nervous system, or even if we are truly in danger, this burst of energy so we can fight or flee from a real danger. And then after the danger is gone, or we cruise off that energy for a while, for that passion in our work or in our life, and it starts to decline and we hit a parasympathetic response of activation. And then we have, once again, a discharge of the sympathetic nervous system, and we cruise off that energy, and then we have a discharge of the parasympathetic nervous system and the relaxing of the body. And that really is a healthy cycle that we should have. But unfortunately, because we're constantly being bombarded by threats in our environment that are not real, threatened by our wife asking us, did you take your vitamins? Threatened by our boss saying, you're halfway to meeting your quota this month. Are you going to pick up the game? Threatened by even probably getting an F in school. Whatever the case may be, we have this activated sympathetic nervous system, and we're just on red line, hypervigilant, looking for when the next threat is. And it's draining. And you can see, if we're doing that, how easy it can become burned out. How easily compassion fatigue can kick in. And how easily our health can deteriorate. So that really brings us to, how do we develop the resiliency? And when I say developing the resiliency, it's talking about how we develop the resiliency, not just to combat burnout, to combat compassion fatigue, to combat traumatic stress, and to combat any other type of work-related stress. How do we become resilient? How do we spring back and become resilient when we're facing challenges or when we're challenging adversity? And the only way we can do that is to build this resiliency. And there are 6 skills. I'll get to the 6 skills that we teach to build the resiliency. But let me just focus on the first skill, which is self-regulation, and why self-regulation works. Self-regulation, as you notice, there's that, we talked about that balance of the autonomic nervous system, the parasympathetic nervous system, sympathetic nervous system, parasympathetic nervous system. As we do this, as we can continue having this balance in our autonomic nervous system, we increase our resiliency. Now, how is that accomplished? Many of you probably heard about Hibb's law, what fires together, cells that fires together, wires together. And this is the basic principle that is actually building a resiliency. And when we teach you these skills of self-relaxation. So, and an example would be, if I were to have told that law enforcer, every time your wife tells you, did you take your vitamins? If I would have taught him a skill to decrease the activity in the sympathetic nervous system and activate the activity in the parasympathetic nervous system to regain that balance. One time, still going to bother him, but if he continued doing this, every time his wife said, did you take your vitamins? And he did a relaxation and activated the parasympathetic nervous system. Wife says, did you take your vitamins next day? And activated the parasympathetic nervous system. Cells that fire together, wire together. Eventually what will happen is he'll start desensitizing himself to the question, did you take your vitamins? Because what's happening in the autonomic nervous system, we're pairing the parasympathetic nervous system, the activation of relaxation, I'm not in danger, and we're pairing that to a stressor in his life, the question, did you take your vitamins? And as we continue doing this, we increase our resiliency, we increase our capacity to deal with harder challenges because he desensitizes himself to this question. But what's happening and actually happening in our autonomic nervous system, instead of the first time, did you take your vitamins, and we have a peak charge of the sympathetic nervous system, now he's activating his parasympathetic nervous system during the time that she's asking, or soon after she asked that question. The next time he gets another charge and he continues doing this, eventually the charge is not as strong. The charge becomes less of a sympathetic charge. And he continues doing that, and it becomes dissipated. That charge doesn't become as strong, to eventually the charge of a sympathetic nervous system is gone, and it's completely desensitized, and he can hear his wife and turn to his wife with a parasympathetic nervous system and turn to her and say, thank you for caring for me. You don't have to, but you do it anyway. And I do appreciate that. But he couldn't do that in a sympathetic nervous system, which was charged with danger, threat in his environment. And so I mention this cycle because it's really important. And as I tell professionals and I tell students, you can't reach this cycle by doing it once. You're going to have to pair. Every time you have a challenge, you're going to have to do these resiliency skills and continue pairing it with the parasympathetic nervous system till those cells that fire together, wire together, which doesn't happen overnight. And as you continue doing this, you can continue building your resiliency to face even more difficult and challenging situations in your life. Now, the opposite is also true. And that's probably what we've been doing now. Every time we're stressed out, we allow ourselves to get activated. Stressed out, activated. Those cells continue to pair together and they continue to wire together. And it's the reason why, if you've ever noticed in moments of duress and stress, you seem to have less and less patience after a while. Because you're doing the exact opposite. You're still building, like any muscle, the sympathetic nervous system. Every time I have a challenge, every time I'm stressed out, I'm going to become activated. I'm going to leash out at this person instead of doing the opposite and building resiliency. So here are the skills, the 6 skills that we generally teach students and professionals to build resiliency. And when I say, and I do mention a lot students, and I say this because my goal and my passion now that I'm, I 15 years I've worked in the mental health, and now I'm in the educational system. And my goal and my passion now is to teach these students who will one day become mental health professionals, these students who will one day become paramedics, nurses, doctors, to teach them the resiliency skills that they need so they don't get burned out once they start working in the profession. But my passion is also to teach those that are already in the field, who unfortunately, school did us a disservice because they taught us the hard skills, they taught us how to do our work, but they never taught us the soft skills and how to survive our job. So my passion is also to teach professionals in the field how to continue flourishing, how to become resilient, and how to become successful and enjoy your work. Enjoy working with someone and helping someone despite the fact that they're suffering and you're experiencing their pain. So the 6 skills that we teach is self-regulation, intentionality, perceptual maturation, and cognition. I give you cognitive reconstruction. I give you an example of an exercise that we do to change someone's perception. Grit, which is how to develop that passion and persistence in whatever work you're doing. Connection and support, and self-care and revitalization. Now, of course, we're just about done with our hour, and I wouldn't by no means have the time to go through all the 6 skills and the activities that I give professionals and students to start practicing this, because as we mentioned earlier, if you don't practice these skills, they never become embedded. You never start to develop the resiliency. Practicing these skills just one time, it'll be nice in that moment, but you won't develop the resiliency. You'll have to consistently practice these skills on an ongoing basis for it to become permanent, for it to build. It's like any muscle. If you don't build that muscle, if you don't build the muscle of the parasympathetic nervous system in times that you need it, in times of duress, in times of stress, it won't become activated. You'll have to intentionally activate it. But if we continue building that resiliency in times of duress and times of stress, you'll notice how easy it is to get through challenging times, how things don't bother you as they did in the past. And it's because of the practice, the ongoing practice of the parasympathetic nervous system. And that's the first tool that we use, is the self-regulation. So there's various self-regulation that I teach, anywhere ranging from breathing exercises to biofeedback to mindfulness. I'm trained in mindfulness stress reduction, and I do trainings on that. But one of the things that I focus on, one of the skills that I focus heavily on, is conscious muscle relaxation and body awareness training. Now, it's not to say that one skill is better than other skills. By no means. In fact, this skill that I will walk you through in a bit is not deep relaxation. It's just enough relaxation to trigger the parasympathetic nervous system. The reason I focus primarily on those two skills, although I teach the other skills as well, which allow deep relaxation, is that the other skills are a little bit more, or actually more cumbersome. And they don't allow you the ability to practice them in the moment, which is really essential to practice if you want to build resiliency, to practice in the moment when I'm having a challenging time to activate that autonomic nervous system. What I mean by that, we all know about breathing exercises. Every one of us have been told, take a couple of deep breaths. Imagine me having an argument with my boss. And in the middle of the argument, I tell my boss, hold on one second. Okay, continue. Cumbersome, disruptive, powerful. I even felt relaxed right now. Felt less pain in my back. But it doesn't allow me to practice that. No one's going to, in the middle of an argument, stop the argument, let me take a couple of deep breaths. Or in the middle of a session, as case managers are working a session or therapists are working in a therapeutic session, and you're feeling dysregulated, your muscles are tightening up, it becomes a little awkward to say, hold on one second, I know you're telling me about your traumatic story, but I'm feeling a little dysregulated, so let me do a couple of breathing exercises. So it's a little cumbersome, it's intrusive. On the contrary, some of the conscious relaxation techniques, muscle relaxation techniques, and the body awareness can be practiced at any time, at any moment, and people won't even know you're doing them. In fact, I'm doing them right now and you don't even know it. Let me walk you through one of those exercises quickly because we're running out of time. I think we're right at the time, so I apologize for those of you that have to leave within the hour. I'll just have about 5 more minutes of your time, and then we'll wrap it up. I just want to walk you through one exercise that you can take to work and you can practice. Whether it's you're like the police officer who you have a hard time, you get tensed, or your muscles get tensed because your wife says take your vitamins, or your husband makes a comment and you get tensed out, or whether it's I get tense with my boss, or I get tense with work, or I get tensed at any situation. This is the exercise I'd like you to practice on an ongoing basis. Or in a session, when you notice that your muscles are tensing up because it's a traumatic story that your client's telling you. You'll build a resiliency by activating that parasympathetic nervous system to protect you against secondary traumatic stress, just by doing this simple exercise, which is, and many of you probably already know, a body scan. You can start from head to toe, or toe to head, doesn't really matter, whatever works best for you. So what I'd like you to do, and you don't even have to close your eyes, right? Because like I said, you can do this at any time, any place, anywhere. I'd like you to scan your body. You're going to start with your head, start with your forehead. And if you notice that the muscles in your forehead are tensed, intentionally and deliberately just loosen them. The muscles of your face, Loosen those. Your neck, shoulders, just drop them. Loosen those. Your chest, if there's any tension there, you're the one that's squeezing those muscles. Just stop squeezing them. Just loosen those muscles. In the buttocks area, notice if there's any tension. If there is, just loosen that area. Relax it. Your legs, your chins, and even your feet. And for 5 seconds is all you need to do that. And it's a simple tool to activate the parasympathetic nervous system. And guess what? Like I said, you can practice this skill anywhere and any place. In the middle of a discussion with your boss, you can practice this tool. And as you continue practicing this tool, especially in those moments, challenging moments, you increase your ability to activate the parasympathetic nervous system. And it becomes easier and easier. You become desensitized to those events that really stress you out. And you will find yourself being able to face even more challenging situations and dealing with it with a parasympathetic nervous system with ease. All right. I had mentioned this, and I'll just mention it briefly. It is really this tool for those of you that are working in the field. We teach this tool to therapists, to case managers, as you're listening to your clients and they're telling you stressful events. If you ever noticed your body, it starts to tense. It becomes impossible to not absorb a client's energy. If you have a child who's telling you a traumatic story, a sexually traumatic story, you're listening to that story and you're absorbing that energy. And unless you build the antibodies, you yourself will start developing secondary traumatic stress and symptoms of that such. And after time, one time, not a problem. But after time, story after story, you get burned out. You start developing compassion fatigue. And so the antibody for you not to develop those symptoms of secondary traumatic stress when you're with your clients is to really take that moment as you're engaged with the story and your client, to take some time and pause for a second. They don't even know you're pausing as they're talking. Just scan your body. Relax it. Go through a body scan, relax the muscles, and then come right back to the client. If you're able to do this, you can build a resiliency against secondary traumatic stress, which then eventually could lead to burnout and compassion fatigue. So these are powerful tools, and I encourage you to continue using the tools. Keep on building. This is just one tool. There's 6 other domains, and there's many other tools that even within self-relaxation. Find whatever works for you. If this didn't work for you, find another tool. But in my experience, I've had professionals come back to me and my students come back to me, even though they use breathing exercise, they'll tell me, well, in the beginning, the self-relaxation didn't give me or the body scan didn't give me that deep relaxation that meditation does. And it's not intended to do that. It's intended just to activate the parasympathetic nervous system. But over time, as they continue practice, they come back and they tell me, now it does give me that deep relaxation that breathing exercises does. And then I can see why it's just more applicable than in breathing exercises, because it doesn't intrude and it doesn't interrupt in our daily activities. Well, thank you. Here's my email if you have any questions. And I look forward to meeting some of you at maybe in a classroom setting or in a workshop setting. Whatever the case, you can reach out, send me an email. You can reach out to the Arizona Trauma Institute. For those of you are wanting a full training, you can reach out to the Arizona Trauma Institute and request a full training at your site. Thank you, and you have a great day.